Hello, my name is Gary Schwander. I'm a sports massage instructor here at the ASHA School of Massage and also work in the ASHA Wellness Clinic. Today I'm going to talk about sports massage. I've been a sports massage therapist for 20 years. During that time I had the opportunity to provide sports massage for athletes at the 1996 Olympics, the 2002 Olympics, and I also worked in the New York Mets Rehab Clinic in Port St. Lucie, Florida. So with sports massage, we have a number of different types of sports massage. We have event sports massage, where we actually go to the athlete's competition, where we can provide pre-event massage that helps the athlete prepare for their competition. Inter-event massage, where we can work on the athlete in between their competitions to help them recover from their first event, prepare them for their next event. And then post-event massage after their competition, which will help them with the recovery so they can get back to their training that much more quickly and at a higher level. We also do remedial sports massage, where we work with debilitating conditions. These are conditions that are going to affect the athlete's performance but not stop them from performing. Things like a sore back, a sore knee, a sore shoulder. So the aches and pains that are going to affect their performance, and we can help with that. We also have rehabilitative sports massage, where after a disabling injury, which does stop the athlete from competing, we can help with their recovery and help them get back to their previous level. And then there's maintenance sports massage, where we work with the athletes on a regular basis, where we can find minor problems before they develop into major problems, and so that they can maintain their activity again at a higher level. So at the clinic here, one of the main things we look at is that the body is in alignment. So we'll do a postural analysis, and we'll look at from the front with the nose lined up with the chin, with the sternum through the belly button, the whole way down to the pelvis. From the side, we want the ear lined up with the shoulder, lined up with the hip, with the knee, and with the ankle. So when the body is lined up, gravity can flow freely through the body. But what happens when the body gets out of alignment, over time, gravity will push it further and further out of alignment. One of the main things we see with athletes and other active people, we have a lot of people coming in and complaining about tight hamstrings, and they want their hamstrings stretched. So when we do our postural assessment, if we notice an anterior rotation of the pelvis, where the front of the pelvis is coming forward, the back of the pelvis kind of lifts up a little bit on the bottom, what that tells us is there's tight muscles in the front of the leg pulling the pelvis down, also in the lower back, which is pulling the pelvis up to make it rotate. And so these are the muscles that are tight and contracted. And so what's really happened, because the pelvis is tilted forward, that rises up the back of the pelvis where the hamstrings tie in. So what's really happened is these hamstrings are actually weak and lengthened, like pulling on a rubber band. So instead of stretching those muscles, we really need to strengthen those muscles, and we need to stretch the opposite muscles that are in the front. So we utilize a lot of different techniques here at the ASHA Clinic, also teach a lot of different techniques. And so we use structural integration, neuromuscular therapy, muscle energy techniques, myofascial release. So I'm going to demonstrate some muscle energy techniques today. So muscle energy techniques uses a combination of passive stretching, where I'll stretch the muscle for the athlete, and then they'll do an active isometric contraction, and so that causes post-isometric relaxation, which will allow us to stretch the muscles even further. So I'll demonstrate just for now on the hamstring. So what I'll do is I'll have my athlete take a deep breath, and as she exhales, I'm going to stretch the muscle. And now she's going to use about 20% of her strength and contract the muscle, the hamstring, by pushing her heel into my palm. And she'll hold that for about 5 seconds. So go ahead. 2, 3, 4, 5. And relax. And now we're able to stretch it a little further. And she'll contract again. 1, 2, 3, 4, 5. And relax. And we'll stretch it a little further. And we'll repeat this 3 to 5 times until we get as much range of motion as possible. So I can push one more time. And relax. So that's going to help to strengthen the muscle because of the active contraction, and it'll also help to stretch the muscle. So that's just one of the techniques that we use in here. When you come into the clinic, we use a number of different techniques. Again, after doing our postural assessments, try to figure out where you're out of balance. And those of you coming to school here at ASHA, this is just some of the techniques that you'll learn to get your athlete back into perfect balance. So thank you for watching this video, and we look forward to seeing you in future videos. Thank you.